All across the country, hospitalizations are rising due to COVID, the flu, and RSV. And those numbers are expected to continue to increase even more as people are gathering together for the holidays, of course. So what is driving it all? Well, just before air, I talked to Dr. Anthony Fauci about this, as well as his imminent retirement as director of the National Institute of Allergy and Infectious Diseases. Watch. And Dr. Fauci, we now have these three respiratory viruses just overwhelming hospitals. And I've heard many a doctor and hospital administrator, quite frankly, say that what we're looking at is really unprecedented times here. If an immunity gap is some of what's driving this, when do you think we close this gap? Or do you think this is the new normal with this convergence of these viruses?
No, it doesn't have to be the new normal, Kate, for the simple reason that we have good countermeasures for at least two out of those three. And the three you're referring to is COVID, influenza, and respiratory syncytial virus. We've got to get people to get vaccinated to protect them, their family, and society. We have a vaccine for flu, and we're having a pretty bad and early flu season. If you look at the trajectory of the flu, it's almost a vertical line upward. But we have a flu vaccine that is matched well to the circulating strain. So there's no reason at all not to get a flu vaccine. And the same holds true for the COVID booster that is the updated BA.4/5 bivalent that's available, but unfortunately only about 13% of the eligible people in this country have received that. Now, RSV is a different story. We don't yet have a vaccine for RSV, but with regard to respiratory hygiene and wearing a mask appropriately in an indoor setting, I'm not talking about mandating anything. I'm talking about the common sense of when you go into a congregate setting, particularly when you have a lot of infection like that you think about the possibility of wearing a mask. And one of the somewhat encouraging things is that RSV, as bad as it is, particularly for young children and for the elderly, we have peaked there, it looks like, and is starting to come down. So let's hope it continues to have a trajectory downward so we don't have challenge with RSV as much as we had over the past few weeks.
It's good to see that there may be some hope there on that one, at least in the interim, that they could be ticking down, at least on one of these viruses. One thing I wanted to ask you about, because I've been long interested in it, is I know the NIH is studying the phenomenon of long COVID. And the CDC just put out a report saying that long COVID has played a part in the deaths of more than 3,500 people so far as they've been studying in the pandemic. It's really the first kind of official attempt to quantify the number of long COVID deaths. What is your biggest question about what still remains quite a mystery with long COVID?
Yeah, it is. It is a post-acute viral syndrome that is real. It can be mild in the sense of having people have a lingering fatigue for a period of weeks to months, but it also, in some individuals, can be rather incapacitating. In fact, even as you said, rarely, but leading to serious disease and sometimes death. But rather than the mortality of it, the thing that we're concerned about is if you look at the fraction of people, and the fraction varies depending upon what you look at regarding criteria, it can be anywhere from 5% to up to 15 or more percent. Given the sheer volume and the quantitative nature of the number of people who are infected, even if a small percentage of them get long COVID, that's a lot of people whose lives actually will be impacted in a negative way by the persistence of these symptoms. It's estimated that about 1 million people in this country cannot go back to their former employment because of the post-COVID, long COVID syndrome. So it's something that you're right, it's a bit mysterious. We don't know the precise pathogenic mechanism. There's a lot of work going into trying to figure that out, because if you want to do something about it, either to prevent or to treat it, you got to understand what the underlying mechanisms are. We're making some progress there, but we still don't fully understand it.
Yeah. And really no other virus in recent history has become so politicized as COVID-19. I mean, you've found yourself, we've talked about this many times, at the center of some of that angry debate. Elon Musk just came at you and attacked you. But the latest now, Dr. Fauci, is Florida Governor Ron DeSantis. He's now asking the Florida Supreme Court to greenlight an investigation into, and the way he put it, is any and all wrongdoing in Florida with respect to COVID-19 vaccines. What's your reaction to that?
I don't have a clue, Kate, what he's asking for. I mean, we have a vaccine that unequivocally is highly effective and safe and has saved literally millions of lives. The Commonwealth Fund has come out with a report just this past week that vaccinations that have been administered over this period of time, this last year and a half to 2 years, has saved 3.2 million lives, 18 million hospitalizations, and approximately $1 trillion in costs. So what's the problem with vaccines? I mean, vaccines are life-saving. So quite frankly, Kate, I'm not sure what they're trying to do down there.
It kind of gets at a bigger issue I've been wanting to ask you as in one of our final interviews in your role in public health is just one result of the pandemic has sadly been that science has become a divisive topic, politicized and weaponized by some people. Have you thought about how do you pull that back? How do you turn that around?
You know, Kate, if I had an easy answer, I'd give it to you, but it's a very difficult situation. You're absolutely correct. It has been politicized, and it has been politicized in a way that has actually caused lives, because if people don't get vaccinated, which unequivocally is life-saving, because of political ideology or because of misinformation and disinformation, that causes lives. And we've just got to get the American public, regardless of whether you lean left, you lean right, it doesn't matter at all. We're all in this together. We're all human beings, and we're all susceptible to disease that can kill us. So if ever there was a time in society when we need to pull together and recognize that the common enemy is the virus, not each other, we've got to get people to appreciate that. You know, like I said, I don't have an easy answer how we're going to do that. But when people's lives are being lost about this, maybe that'll shake people up enough to realize that we've got to start pulling together and not against each other.
I'm sure you have started kind of reflecting. I know you wrote a very interesting long piece, kind of in a farewell piece of the New York Times, a message to the next generation of scientists. But it has been a wild ride at the tail end of your very long career in public health. I mean, as you head off, would you say you're more optimistic or pessimistic when it comes to public health and the role that it will continue to play in our lives?
Well, I am generally, Kate, a cautious optimist about things. And here's another example, is I really am cautiously optimistic because I believe that the better angels in society will prevail. We're a good people in this country. And although there's divisiveness, I believe we're going to pull out of this, because if you look at what science has done and what science applied to public health has done, it has saved millions of lives in our country and throughout the world. So I do hope we pull together and realize, as you say, although it's been a rocky road over the last 3 years, we know what happens when you all pull together. Lives get saved, and that's what we're all about.
And that is the necessary collaborative work between science and public health. It's great to have you. Thank you, Dr. Fauci.
Thank you for having me, Kate. Good to be with you.